We're learning more about the potential ability of hospitals to handle the growing number of coronavirus patients. A new ProPublica analysis of data from the Harvard Global Health Institute shows which parts of the country could run out of available hospital beds. Anna Werner joins us from San Francisco to break down the numbers. Anna, Bay Area residents are being told to stay home.
Yeah, that's correct. And moves like this shelter-in-place order, where basically you can be in your home, you can go to essential stores, groceries and pharmacies and a couple others, but that's it. Otherwise, they're being told to stay home. Those moves are key because otherwise hospitals may face becoming overloaded with life and death consequences.
At Long Island's Good Samaritan Hospital Medical Center, workers are setting up tents to test people for coronavirus. This large hospital has 437 beds, 64 in the intensive care unit. On any given day, 80 to 85% of those ICU beds are full, limiting capacity for any influx of coronavirus patients. But administrators say they're now getting ready for the worst-case scenario. Patrick O'Shaughnessy is the executive vice president of Catholic Health Services, which runs Good Samaritan.
Some of the things that we are working on and doing are limiting perhaps less severe acute interventions within the hospitals, right? So things that could be done on an elective basis perhaps are going to be delayed or canceled to free up capacity. This is going to be more of a marathon and not a sprint.
But hospitals in some areas of the country are likely to be under more pressure than others. ProPublica created maps using new data from the Harvard Global Health Institute that shows what happens if the virus spreads more quickly or more slowly. In what researchers call the best-case scenario, where 20% of adults are infected with coronavirus over a span of 18 months, the map shows hospitals can largely accommodate the influx. But ProPublica reports even then, beds would be 95% full. But now look at the path for the worst-case scenarios. First, with 20% of adults becoming infected over 6 months. At that rate, hospitals in the red regions quickly need many more beds than they actually have. Then, if 60% of adults get coronavirus in a 6-month time span, the map turns virtually all red, meaning the U.S. would need more than 7 times the number of available hospital beds than it currently has. What it shows, says the Harvard Institute's director, Dr. Ashish Jha,
the data says that if we fail to act, if we go with the status quo, we are going to be in a lot of trouble. That most hospitals in most communities are going to end up getting overwhelmed.
For hospitals, he says, that means freeing up beds. For communities, it's about continuing to shut down public venues, including restaurants and bars.
This is a national emergency where we're all going to have to work together. Every mayor, every governor has to be asking themselves, are they going to be part of the solution or are they going to be part of the problem?
Charles Ornstein is deputy managing editor for ProPublica.
When you look at this data, the one thing that becomes crystal clear is that it is essential that we slow down this pandemic and that we try to stretch it out over as long a period as possible.
A major goal, he says, to avoid a situation similar to Italy's, where doctors in the worst-hit regions are reported to have received guidance to only treat patients deemed worthy of intensive care.
Doctors and hospitals are going to be forced to make decisions they didn't go into medicine for, and essentially that's going to be relegating some patients to death.
Now, the researchers and writers here point out that this information, these models are based on current information. Of course, that can change. Another point from the researchers is that large metro areas and big cities, like here in the Bay Area, are really going to have to work hard to clear out bed space. Rural areas face a major challenge with some of this, with reduced intensive care unit beds. Now, the governor of Ohio issued an order yesterday postponing elective surgeries and procedures for hospitals in an effort to reserve beds for the critically ill patients that they anticipate will be coming in, Tony.
Yeah, Anna, that really crystallizes the need to take these precautions seriously and shelter in place if that's the order in your community, reduce the large gatherings. You're in San Francisco where they have that shelter in place order. Yeah. Are people taking it seriously?
I think they really are. You know, you're seeing people talk about the highways and the freeways here being empty of traffic. There are some stores people are allowed to go to, groceries and pharmacies, but they basically closed down businesses here. So even if you wanted to go into work, you really can't in most cases. And so we think that people are taking it seriously, and hopefully they'll continue to do that.
Yeah, where are you, Anna? It's a very pretty kitchen.
So I'm in Berkeley, California, which is actually across the bay from San Francisco, Gail.
Okay.
All right.
I guess you don't want me to know where you are. I'm in Berkeley, Gail.
She has a very clean refrigerator. That's what I
She's a
thought.
very significant other out there on the
I'm at the
West
house.
Coast.
Okay, all right.
All
I got a home in Berkeley.
Okay,
All right,
got
Anna,
it.
thank you very much. We appreciate it.